perspective, but it is a fact, is that it is a work-life integration, and we have to deal with it. And so, back when I took this job, I decided that I saw some results of some surveys, respect at work, employee engagement, and I realized that I had worked there for a really long time and I knew the operations of the hospital, but I didn't really know what was on the minds of employees. So I spent a whole year and I met with employees. We had 1,800 employees at the time. Now we're more like 2,000. But I invited employees in groups of 8 and 10 to come in and talk to me about what was happening at the hospital. And I learned many things. We've addressed a lot of the issues on throughput, and but we learned about generational differences. We learned about not liking the area in which you work, but not trusting when you transfer the patient to the next area. How to break down the barriers and to understand what other people do. But one of the main things that I learned was that the workforce was clamoring to know more about the social issues in our community and also the social issues that were affecting healthcare. And so we decided we were going to start bursting what we call this social bubble. So we think modern life demands it. I promote it, and employees ask for it. And that's the issue, is that employees are asking for this kind of information. We have a lot to worry about, and some people don't get this. We look at reimbursements, patient safety, our consumer expectations, but social issues that exist in our communities are affecting the behavior, and they are affecting the well-being of our patients as well as our employees. And if we don't address it, it's going to come back and affect our patients. And it's our way of really saying to our employees, we care about them and we care about the communities. So since we've been in this role, we've sort of addressed a lot of issues with the workforce. So I'll just sort of start and go through them. We've addressed human trafficking, and this is something I'm going to talk to you about just briefly here in a minute, so I'll come back to that. But the opioid epidemic, generational diversity. This was a huge issue that came out. The people's perception of each other, you could directly tie back to the generation they were in, how they defined hard work, how they look at the cell phones and the technology that is used. We looked at the stuff that was happening with the Me Too movement, and we looked at mental health. I had 2 employees commit suicide in the last year and a half, and after I went to the second service for the individual, I thought we have to do something, and we began to talk about it as a workforce and really find out a lot that was happening. And we're in healthcare. We needed to promote that your mental health was as important as your physical health. We believe it. We looked at our benefit structures. We've just unveiled new benefit structures that make it more affordable for employees to get routine mental health. We've increased the number of our employee assistance program access to care, and we meet with employees to talk about what kinds of stressors they're dealing with. Down here I'll go to bias. Everything that we do in the hospital, as individuals, we all have both conscious and unconscious bias. And I've become very vocal. As I look at challenges with patients, as I look at issues that are taking place between employees, most of these things can go back to a bias. And not all biases are necessarily bad. We all have our belief systems, our value systems, our faith. But when you come into a hospital, it's a no judgment zone. So if a woman delivers a baby who's drug addicted, as a caregiver, it is not your place to judge it. Your place is to listen to those people and take care of them, and the system will get them the services they need. It's a very hard thing to do. And when you see the challenges in society, they creep into your walls. And so we are constantly talking about bias. There is bias associated with mental health. There is bias associated with human trafficking victims. Bias associated with drug-addicted individuals, alcohol-addicted individuals, you name it. It is so easy to have a bias. And in my hospital, it's a no-judgment zone. And we talk about this. We are working toward it. Every person wants to be heard, and every person wants to be understood. And we may not understand everybody, but we're going to listen to people, and we're certainly not going to judge them. And so by talking about these social issues with the workforce, you begin to start to break down those barriers. And one of the major things we have here is financial wellness. And I did want to tell you 35% of our workforce is now millennial or Generation Z, and they're focused on the social impact of things. They're interested in seeing how their work and society is connected, and we feel that that's very important. But let me find this. Surveys nationally show that 2 out of every 3 employees in our country are stressed by financial issues, and 45% of employees have less than $1,000 in savings. So what we are finding is that it doesn't matter what your income is, and some people who have the highest incomes are the most financially stressed because they spend what they make. And those things tie back. And we're finding in schools, they're not teaching people how to have a budget and how to, why you should be saving into a 401k, how you should look at your loans and pay the highest interest loans first before paying off your 2.5% interest. You can go on and on with it, but it is those things that stress out the workforce and then cause the dynamic between employees. And I believe that if we're not good together as a workforce, we're never going to be as good as we can for our patients. And so that really has been our commitment. And it really seems to be working. I communicate every other week or so with the employees. I'm the only person that can blast email employees. I meet with them once a year, and they're mandated to come and hear sort of a State of the Union about the hospital. But we are talking about these issues. And Linda Corbin, I've had this conversation before. She'll say it's maternal. I'm going to, in deference, say it is a paternal role. I think it is probably the most surprising thing that I have learned in this job over the last 4.5 years is how much your workforce doesn't know. I mean, somebody asked me one day, what are your leadership style, your strategy? And I finally said, it just dawned on me in the last year that the greatest gift that I was given was to be raised by kind people. And people are raised in situations or come in with circumstances that you can't even quite imagine, and it infiltrates the workplace. And so we try to be models of good and appropriate behavior, how to have difficult conversations with people that don't have to wreck your world. You can have a difference of opinion, and it doesn't mean both of you are bad people. You just agree to disagree. You kind of move forward. And we're teaching basic mediation kind of strategies and financial wellness and teaching people about their biases and how to be kind and treat one another well. And it may seem crazy to you, but I believe in this. It has worked for us because what we have seen is, I've told you about our internal communication. We're doing these mission-related trainings. We've redesigned policies and benefits. We have employees involved. And we have found that we have higher employee engagement. We measure employees through national surveys. They look at whether you're disengaged, ambivalent, content, or engaged. I inherited a content workforce. 5 years ago, I want an engaged workforce. Those people who are emotionally connected to the organization, loyal, and they see their personal connection to our success. And what you can see here, and doesn't matter, but disengaged is all the way to the left, ambivalent, content, and engaged. Every other year, we've been doing full engagement surveys with pulse surveys in between, and you can see here that we have gone from the 33rd percentile of an engaged workforce in 4.5 years to 50.3% of our workforce saying they're engaged in our work. These are hard needles to move, but we are driving down the disengaged, ambivalent, and content, and we're having engaged workforce. And I've been challenging my team, once you make a big jump, how are you going to jump the next 25, 30%? That's what we're focused on right now. So we have higher employee engagement.